Hi everyone, I'm Dr. Gafoor, a surgeon in Island Hospital, and welcome to this session of our webinar or Facebook Live entitled Big Surgeries, Big People with Small Scars. Hi, so let's start with a little bit of introduction about myself. I am a general MIS, which is minimal invasive surgeon, and bariatric. So don't confuse bariatric with pediatric. Bariatric is a surgeon that manages weight loss. A pediatric surgeon is a surgeon that manages pediatric or children. So I was born in Ipoh. Many people don't seem to believe that, because my name and how I look, that I am local. Tapi saya sangat-sangat orang Malaysia sebenarnya. And I had my early schooling in ACS Ipoh, Anglo-Chinese School Ipoh. And I finished my medical degree locally, and I finished my master's in surgery as well locally. I finished my fellowship at the Royal College of Surgeons, Edinburgh, and I proceeded with a few other training. I spent quite a few years in Taiwan, where I finished my fellowship in colorectal surgery as well as bariatric surgery as well. I have been a surgeon in the public sector in the Ministry of Health for almost 8 years now. And it has been a wonderful journey, and I have worked all over the country. I've worked in Sabah, in Sandakan, and when I was covering Sandakan, I was also posted to various hospitals in Sabah like Keningau, Lahad Datu, Kota Kinabalu, as well as um, other hospitals within the vicinity. I worked in Langkawi for quite some time, and I was posted to Ipoh Hospital. I started my career as a houseman in Hospital Ipoh, and then I ended my career as well in government service at Ipoh Hospital. Okay, so let's go into the business of what we are talking about today. What do I do? I'm a surgeon, so I do a lot of operations that have got problems that people come to me to remove. Basically, the most common that people come and see me is usually for lumps and bumps. So lumps and bumps is actually the bengkak-bengkak that you have on the body that is commonly present, but it can have problems, but you want it removed. The second and third most common is hernia and thyroids. Hernia is actually a swelling in the groin area, and thyroid most commonly affects our women with a swelling in the neck area. I also manage a lot of cancers. I manage circumcision and hernia for children. I do hemorrhoid treatment as well as surgery. I do some endoscopy, even though I do less at Island Hospital because we have a pool of gastroenterologists who are very well trained. I do bariatric and weight loss surgery, and others are things like varicose vein, piles, and abscesses. So the topic today is big surgeries, small scars, and big people. So let's start with lumps and bumps. So what type of lumps and bumps are there that people come to me for? They would want me to actually have a look at lumps and bumps such as acne, boils, lipomas, which is actually fat swellings, and nodules anywhere in the body. That would be what I would be most commonly sought after for. So you come and see me, you say that I have this swelling, and normally I will assess what type of swelling it is, and then subsequently what I will do is I will post you for some surgery after a discussion, and it will be removed. Usually the surgery would be a minor procedure, and it will be a day procedure. That means you come in the morning, you have the lumps removed, and then you can go back in the evening. The pain will be very minimal, and it will be controlled by a lot of painkillers, and subsequently you come and see me after that just for removal of the sutures and management of the wound. Now let's talk a bit about hernia surgery. Hernia is actually a swelling in the groin or a swelling that can occur anywhere in the abdomen, inside or outside. Why does a hernia occur? Now, if we see in our body, we have got muscles below the skin of our body. So these muscles, they make sure that whatever is inside stays inside. There will come a time, and there is several instances when these muscles become weak. For example, if we cough a lot or we strain for any reason, for example, going to the toilet or passing urine, then the muscles become stretched when we strain. As the muscles become stretched, small, small holes will appear at the places where they are connected or where they are weakest. And what happens is the intestine inside will come out through that hole, and that's where you have a hernia. So in olden days, hernia is treated like this. Kesian tengok dia kan, dia baring and then someone is holding him down and then someone is trying to reduce the hernia below, and it's very scary and things like that. But in modern times now, we have very good operations for hernia. First is we have open surgery in which we make small incisions and then subsequently we close the hole where it's coming out from, and we put a mesh or a jaring on the hole to strengthen it. Now we have gone one step further. How it is we have developed laparoscopy. That means we make small holes, only about 1 centimeter, zero point 0.5 centimeters around your stomach. We go inside the stomach and then subsequently we repair the hole from inside and we put a mesh. So that results in better post-operative pain. You don't have much problems to the external, there's no big scars, and also you can go back to work faster. And this service is available in our facilities. Next, I'd like to talk a bit about thyroid surgery. So thyroid is a very common problem. And thyroid biasanya bengkak, especially in the neck, is very people don't focus too much about it until it becomes very big. The other reason is because a lot of our population they are Muslim based, so they cover their necks with scarves, tudung. So you don't see the swelling. Usually patients who come, most of the times somebody else has seen the swelling and they have been asked to go to the hospital, and that is why they come to us. But if it is covered, then you tak nampak. So women that, especially this condition normally affects women, and women that have this problem, basically they feel some uneasiness in the neck. They should come for a checkup and we should have a look at what is going on with them. The third category that we do a lot is cancers. We can start from the thyroid, moving down to the breast, abdomen, colon, and surgeons do a lot of cancer surgery. And oftentimes we are the primary team that manages cancer, and we work with other doctors actually to get their cooperation to perform a holistic treatment for the patient. So if the patient comes to us and says that they suspect that they have cancer, sometimes our patient are unsure but they have symptoms. For example, breast cancer. Some patients they come for routine screening. After the age of 50, you are recommended to have a mammogram and an ultrasound or a combination of both every 2 years once. So many women go for these type of screening and they find something. And then, but the women don't feel it. So they come and see us and then we counsel them on how to remove this swelling. Second is if they have symptoms, for example, early satiety, makan cepat kenyang. That would be, and also pain in the epigastric region, on the upper stomach. So this would be an indication that maybe there is a problem with the stomach. Patients that have got blood when they are passing, when they go and pass motion, buang air besar. These are all patients that come to us with symptoms, and then we investigate, we find what is their problem, we help them, we counsel them, we remove the problem the best way we can and with the least amount of trauma. The best way is through laparoscopy because we don't make big incisions but we make small holes. And also we make it comfortable for them because we make it into a holistic approach. We work with a team that has got a dietitian, a counselor, a physiotherapist, as well as other doctors that can come and help us in managing this cancer. So you can manage cancer with open surgery, keyhole surgery, and we want to embark as well on robotic surgery in times to come. So open surgery is basically you use a scalpel and you cut the particular tissue and then you go into the organ, you remove what is needed and then you stitch up. This is actually the traditional way of doing surgery that has been done even from 700 AD until now. So it has been there for a long time. It has lasted the tide of the test of time, and it remains to be important until now. What we are popular for, or what we would like to advocate, is laparoscopic surgery. This is keyhole surgery, like what I explained before. And you can see in this diagram, you use small holes, and you use audio visual, like very high resolution cameras and TV, and then you use equipment to do your work, and then subsequently you have the same outcome as open surgery with less trauma. So pembedahan ni sama saja sebenarnya, tetapi the trauma yang disebabkan oleh pembedahan is much less. Okay, so these are a few differences between open and laparoscopic surgery. Open surgery, you have large single incisions. Laparoscopic, you have smaller. Open, you have longer hospital stays. Laparoscopic, you have shorter, very significantly shorter. And open surgery, you may have longer recovery time. And laparoscopic surgery, you may have a shorter recovery time. So these are the diagrammatic. This is the diagram of how we do it. As you can see, open surgery, you need to cut, you need to retract. Those two metal pieces there you see are actually retractors. So you need to retract, and you need to show patients, you need to see what is going on inside. But with the camera system, you can do all that with actually much less trauma, and actually just small holes. Okay, so let's spend some time now to discuss about the other aspect of work that I do in Island Hospital a bit. I manage what is known as bariatric surgery or obesity. As you know now, obesity is a global epidemic. There are a lot of patients, a lot of people suffering from this problem. And in Southeast Asia, Malaysia is the most obese state per capita. That means per a specific number of population, we are the highest number of overweight population. We are the champions in Southeast Asia. In fact, we are very close to the Middle Eastern countries, and but in Southeast Asia, we are number one in this. So this is a big problem actually in Asia, and our figures now are almost approaching 50%. That means one in every two patients actually are classified as obese if we look at data for our survey that is done in terms of census. So recently there is an MCO that has been implemented, and we find that patients who are coming to us after MCO, the obesity rates have gone up even more. Yeah, if you stay at home and you're unable to do any activities like your normal day-to-day activities, walking around, seeing friends, or even your exercise routine, you tend to gain weight. So we find that obesity now has become more of a problem as compared to when it was before the MCO period. And this is a good picture about what happens about obesity before MCO and after MCO. So how do we determine which type of patients would benefit from our treatment? So there is a difference between the Western population and Asian population. The Western population, their cutoffs for how you classify whether patients are overweight and obese are much higher than us. For example, for our local population, kita orang Malaysia ni, untuk nak tentukan sama ada kita tu overweight atau kita tu obese, tahap dia tu sebenarnya adalah lebih rendah daripada masyarakat di Amerika Syarikat atau masyarakat Barat. So if you see for non-Asians, overweight can go up to 29.9 BMI. But BMI ni is actually body mass index. How you calculate is you take your weight in kilograms and you divide by your height in meters squared. So use a calculator and you calculate and you can get it quite easily. If your BMI as an Asian is 27.5 and above, you are classified as being overweight. If it is 32.5 and above, you are classified as being obese. So it is much lower as compared to the Western punya classification that is actually 35 and more. Okay, all right. Next would be, what are the causes and consequences of obesity? The causes is basically eating too much. That means there is a disproportion between consumption and activity. And now with the current availability of Food Panda, Grab Food, and then now newer operators, food can be delivered directly to your doorstep, and you have the abundance of choice of choosing any food you want. So the resistance and actually the will to actually eat more is there because you have so much of auditory stimuluses. Of course, another factor is genetics. Some people are more prone to become obese than others. So you cannot just say that obese people are obese because they eat a lot. Makan banyak so jadi obese, bukan. There is a genetic predisposition as well. Certain medications. So kalau kita makan some medications, these medications actually cause us to have a reduced metabolic rate and we can become obese. Stress. With the MCO now, we are seeing that a lot of people are coming with heightened stress levels. And this is because, the moratorium may end in October. There are financial stress implicated. And also, generally, we are all very worried about what's happening with COVID. So, stress level goes up. This will push you to actually consume more at times. And then subsequently, weight will go up. Poor sleep. This is a very important element. Patients that have got poor sleep, we find the patients that have got poor sleep generally have a propensity to gain more weight. Sleeping habits have changed, over the past couple of decades. The reason is because we have smart devices, we have Netflix, we have YouTube, we have iPhone. So we don't have that healthy pre-sleep preparation to go to sleep. And there are a lot of reasons for us to stay awake late into the night and then going to sleep and getting up early in the morning. So you need to have a good amount of rest actually to lose weight. Hormonal imbalance. This is something that we work very hard to determine if you have it. So when you come to us, we will check the hormonal levels that you have, the most common ones, and determine if you suffer from these hormonal imbalances, treat them first, and then offer you treatment in bariatrics. So it's actually quite a comprehensive process when you come and see us. What are the consequences? Of course, heart disease and diabetes. This is called the king and queen of diseases in the world. Raja dan Ratu penyakit lah. Heart disease is the Raja, Ratu is the diabetes. Kidney problems, fatty liver, which almost affects a large number of people, cancers, and high blood pressure. In fact, if you are obese, you have an 8% chance more of developing cancers as opposed to a non-obese patient. So this is why we are very aggressive when we want to treat obesity. So what type of cancers actually can obesity cause? Almost all of them. But the most common that we manage is usually colorectal. That means cancer in the usus, in the bowel, and also in the rectum, ovary, as well as stomach and gallbladder. These are all common cancers that we manage, and it is related a large amount to obesity. So how do you overcome obesity? Number one, avoiding stress. So you need to have a very healthy outlook on how you manage your stress on a daily basis. Managing stress can vary from people to people. It can be as simple as listening to some Spotify, to as complex as going through meditation and going through complex, maybe even hypnosis or procedures that will help you relax. Get enough sleep. I cannot emphasize this more. Get enough sleep. Patients that have got adequate rest usually will have a better chance of losing weight. Avoid fast food. The reason is because there's a very high content of sugar and also a very high content of salt and oil. So avoid. More water. Very, very important. Consume 1.2 to 1.5 liters of water a day. Exercise regularly. Get rid of those bad habits. If you're smoking, try to cut down and then try to come and get some help for those of you who want to quit. Get rid of bad habits like excessive drinking or indulging and things like that. And if you need help in that, we are able to help you as well. So, what are options for obese individuals who struggle with weight loss? We have got as surgeons what is known as bariatric surgery or weight loss surgery. Who are patients who will benefit from bariatric surgery or weight loss surgery? Now, remember how I taught you how to calculate the BMI a while ago? So, use that calculation and determine if you have a BMI of more than 37.5. Usually, if you are of normal Asian height and you are more than 95 kilos, it will be advisable for you to come to us and seek for some help. In fact, even if you're more than 90 kilos at that normal height, it is advised for you to come and see us to get some consultation regarding your weight and how we can manage it better for you. Now, for individuals who have got some problems like hypertension, diabetes, subfertility, that means they've been trying to get children for a long time tapi tak dapat, joint problem, shoulder, knee, or any metabolic disorder. For example, they go and get a scan done and they find that they have a fatty liver. Then, if they have a BMI of even 32.5, they should come to us. And these generally are patients with weight of maybe 85, 80 kilos, depending on your height. You should come and see us, and we can advise you on how you can lose some amount of this weight to prevent you from developing all these other complications that I mentioned before. So, what are metabolic syndromes that I spoke about with the low BMI tadi? High blood sugar levels, high triglycerides, increased blood pressure, excessive fat around the waist. These are all metabolic syndromes that you should come and see us, and we can advise you how to go about managing it. Okay, so the most common surgery that we do is called a sleeve gastrectomy. So this is your normal stomach. Okay, this whole thing. What we do is in this surgery, we remove this portion of your stomach and we only leave it with this small sleeve of stomach that is here. And this would actually result in your stomach becoming much, much smaller. But you may think that kita rasa yang if you remove the stomach, actually what will happen? Number one, definitely your consumption will be less. Definitely kita makan dengan lebih sikit. Sebab dulu kalau kita boleh makan nasi lemak pinggan yang penuh dengan sambal, now maybe kita lalu makan hanya 1/4 saja, kita kenyang dan kita rasa pun kenyang lepas operation ni. Yang kedua is actually when you have this surgery done, there are several hormones that are secreted by the stomach, and these hormones actually cause you to have an increase in appetite. So these hormones act in a feedback to tell you that, oh, you are hungry. And we remove a portion of the stomach that actually secretes a lot of those hormones, namely ghrelin. Okay, so you have to, it is very beneficial on not only reducing the intake, but it also helps you to actually perceive that you don't need to eat so much. The other one is known as a bypass surgery that we perform, and this is more applicable to patients who actually who are diabetics, who don't have such big BMIs, not very big patients. We can offer this type of treatments for them. And of course, we have a third operation, which is a row on Y gastric bypass, where we make the stomach smaller and we connect the small bowel to each other and we reduce the distance of the small bowel. So the food doesn't have to travel through a very long path to come down. We shorten the distance. When you shorten the distance and the food doesn't have to travel on the long path, it is not absorbed into your body. So we create like a highway between your intestine, and the food will drop plop into the highway and plop down. So it's not absorbed into your body. It comes out more quickly. So these are the types of surgeries we have. Now besides this, we also have a gastric balloon. Gastric balloon is we insert a balloon into your stomach and we inflate the balloon and we fill up your stomach with the balloon with water. We can leave the balloon there for 3 to 6 months, and during that time you can lose about 8 to 10 kilos, sometimes even more, up to 15 kilos. But this procedure has to be done together with diet and exercise, which we will help you with as well. The benefit of this procedure is it can be done as a day case. That means you can come in the morning, you have the procedure done, then we can discharge you in the evening. Okay. Now, Botox is gaining popularity as well. It is very much being experimented in a lot of weight loss centers, and we find that it has got good results, and you can come to see us to discuss this as well. Now, what about medical therapy? Are there any medication that can help you to lose weight? There are. One of the most popular ones is this drug by Novo Nordisk called liraglutide. I'm not promoting in any way, but at the moment, this is one of the most effective ones that we have. How they discovered this is very, very interesting. They synthesize the saliva of the biawak, the lizard. The reason how they did this is because we are on a daily basis, we have sometimes when we are not hungry. For example, for me is in the morning. When I wake up in the morning, I'm not hungry. I cannot eat much. This is because in our body we have an enzyme that is secreted at some times. It is called GLP-1. But this enzyme doesn't have a long life. Dia akan survive only for a short time and then you feel hungry again. But in the saliva of the biawak, this enzyme can tahan lama, up to 12 to 16 hours. So this company, they synthesize. That means it is not the biawak saliva. They actually made it in a lab, nothing to do anymore, and then they changed some configurations on that enzyme, and that is the medication that they have. We have this therapy now, and if you couple this with medical therapy and dietary advice that we can give you, actually you can get very good weight loss. And this is very good for patients who are not very big. They want to lose a few kilos, but they don't want to go through any operation, surgery, or they don't want to go through any of this. So they come to us and we can offer them this type of therapy. So we also have a regime where we work with our dietitian and our physiotherapist to help you lose weight through targeted approach. That means we set targets with each other and then we try to accomplish those targets, and we interact very closely with our patients by WhatsApp, by messaging, and we work very closely to involve them into support groups within our network of patients, and I guide the support groups on a daily and weekly basis to make sure that everybody is on track and comfortable with their progress and recovery. So what are the benefits of bariatric surgery? Now, if you are a diabetic and you are overweight, this operation is ideal. And if you're on more than one or two drugs, this operation is perfect actually, because it can induce what is known as long-term remission. You may not have to take your diabetic medications anymore. You can reduce your life-threatening risk like heart attack, stroke, and cancers. This is the most beautiful part about bariatric surgery. You basically intervene at a patient at a particular time and you tremendously help them reduce the risk of them getting a heart attack, stroke, or cancer. You can achieve consistent weight loss. You can improve your heart health. You can have more energy. You can spend more time with your family, with your friends, with your children, with each other. And basically, it is an invigorating procedure that basically gives a lot of people a second chance to live better. All right. So let's take some questions. And I think Joelle has got some questions as well. So let's see what her questions is. Let's see. Number one, I have had an open surgery in abdomen before. Am I still a candidate for laparoscopic surgery? Definitely. You are an ideal candidate for laparoscopic surgery. Orang kata the Power Ranger in laparoscopic surgery is this one. The hebat, the very good aspect is because when you do laparoscopic surgery, you can go into the stomach and you can release what is known as adhesions. Adhesions ni adalah lepas we have a normal surgery, the bowel will stick to each other. But with laparoscope, you can go in, see carefully, remove, and everything is magnified. So your view is much better. You are more precise when you do it, and it is safer to do it in this manner. Number one. Number two, what can I expect immediately after my laparoscopic surgery? Okay, so after laparoscopic surgery, you can expect that there'll be some holes in your stomach which we have stitched up. So it doesn't mean the hole is there and we leave it open. We stitch up the holes, and when you go back, you have some plasters on your stomach. You'll find that there's not much pain actually on the wound. There is some pain inside when we do some work, but outside there's not much pain. And if you have another patient who's undergone the same procedure but by open, what happens is you'll find that you'll be able to move faster than him or her. You can walk around and you can do activities more easier because laparoscopy is not much pain. I see we have a question from Miss Grace. Do we need to remove the balloon in the stomach? Thank you, Grace. Yes, you do. You have to remove. And usually, Grace, we remove the balloon after 3 to 6 months. We see your progress after 3 months, And then subsequently after that, we assess whether or not you have achieved enough weight. If it's enough, we will remove. And the balloon we insert, we can actually inflate to make it even more bigger after 3 months to help you lose more weight. But after 6 months, normally we remove it. The removal is also not very difficult. It's easy. We do it as a daycare procedure where you come in the morning, we give you some sedation, we remove it, then we have a nice coffee after that, and then you can go back. Okay. So what are the possible risks of laparoscopic surgery? Now, the risk of laparoscopic surgery is the same as open surgery. That means if in open surgery you have the risk of developing some problems, in laparoscopic surgery those risks are the same. You are minimizing the trauma on the outside, you are minimizing pain that the patient has, you are improving the visual aid to the surgeons, you are minimizing how big the scar is, but the risks are almost the same, and in some instances the risks are less for laparoscopic surgery. Okay, since the incisions are so small, why can't minimally invasive surgery be done with local anesthetic? That's a good question. Now, the reason is because the holes are only helping us to gain access to what is going on inside your body. So, even though we have pain outside, we also have pain inside. So, because of that, when we give local anesthesia and we control only pain outside, if we don't give gel anesthesia, it will be very painful when we do the procedure inside. Having said that, there are some procedures that we can perform awake with local anesthesia, and it has become popular, for example, in thoracic surgery in the lungs. So we have an option where we can make small incisions and we can perform these thoracic surgeries with the patient being awake at times, but the indications are very precise. But generally, if you want to perform laparoscopy, it has to be done under general anesthesia. Thank you for the question. It's very good. Now, under what circumstance will a laparoscopic surgery be converted to open surgery? Good question. If we do laparoscopic surgery and we find for any reason that it is difficult to complete the procedure by laparoscopy, we will convert to open. If we find that we are struggling by laparoscope to progress in our surgery, we will convert to open surgery. If we find that we have a problem during laparoscopic surgery, bleeding or something that we cannot see, we'll convert to open surgery. And usually if it is needed, we can convert it within about 90 seconds and we can get access into what we want and we can manage it very quickly. So it's a very, very safe procedure, and I would like to reassure everyone that it can be done quite easily. Next question, what will be my physical restrictions following thyroid surgery? So thyroid surgery would involve a small cut in the neck here, and then subsequently we do our work and we close the lubang. Mainly patients tell me that the only restriction that they may have is they cannot move their head in the early part of the surgery too much up and down because this part sticks a bit. So they find that dia melekat sikit selepas operation, but this is not permanent. Usually after a few weeks this condition will go away. Beyond that, there is no restriction. You can run a marathon, you can swim once the wound has healed well, you can eat, you can sleep, you can do any activities that you like to do, you can go on social media, and there's no actual restrictions. So this is a nice question. I am a female and my BMI is 26. So am I still eligible for weight loss surgery? So the easy answer here is no. At a BMI of 26, it is more of a cosmetic element. You want to lose weight to actually look good, and we can actually help you with that. There are several options available for these type of patients. For example, medical therapy are available, and some sort of endoscopies are also available. But generally, for weight loss surgery or bariatric surgery, the indications are very precise. You are either 32.5, 32.5 with some other medical problems, or you have a BMI of 37.5 and you have got no problems. This is an indication for you to come and see us. My weight is 130 kilos now. How much weight will I lose after the surgery? Okay, excellent. Let's do a bit of calculation. If you are like me, about 175 centimeters, your ideal weight should be about 80 kilos. 75 to 80 kilos will take the upper limit. So now you have an excess of 130 minus 80, 50 kilos. If you do bariatric surgery, you are expected to lose 80% of your excess weight within 6 months of the surgery. So you are expected to lose about, let's make the calculation, 80% of 50 kilos. So that will be about 40 kilos. Yeah. So you will lose about 40 kilos of that weight within 6 months. This is our goal. And we will help you to achieve this goal actually by frequently seeing you, by frequently engaging with you on social WhatsApp messaging, finding out how you're doing, putting you into support groups to help each other. And we will also have programs like walking, our cook shows, our dietetic advisors and things like that, all geared up to help you lose as much weight as possible. So, number nine, how will weight loss surgery affect our health for the rest of our life? It has got a tremendous implication. It will give you a new lease in your life, basically, in terms of energy, in terms of your emotions to your surroundings, and also give you a momentum of confidence that you may be lacking before that. On the medical side, it has got tremendous benefits in heart, cancer, diabetes. It's just an endless benefits. Now, what is the do's and don'ts after weight loss surgery? Main do's and don'ts is you have to don't eat unhealthy food because we are helping you to actually achieve weight. We are giving you a jump start, but the rest is up to you. The other don'ts is don't lead a sedentary lifestyle. You have to be active, go for walks. If you used to play some sports, go back onto it, swim, meet people, keep yourself active. And that is the main don'ts. The do's is look for the type of diet that excites you. This is very interesting, because some people are excited by Western Mediterranean food, by Indian food, by Malay food, by fusion, by sushi. And there are healthy variants to all these types of food that you can inculcate into your lifestyle. How do I know which weight loss surgery is right for me? This is something that you have to come and discuss with your bariatric surgeon. Different surgeons have got different preferences, and also different surgeries will actually it is orang kata you kena tepuk dada tanya selera sikit. So you may have a condition that is ideal for specific surgeries and not ideal for others, and this would be best discussed with your bariatric surgeon. Do I need to go for extra reconstructive surgery after my weight loss surgery? Good question. Some people after the surgery they have got skin sag in the stomach, underarms, and the back. So you can go for reconstructive surgery if the skin sag is very bad, or there are some machine-based therapy using diatomy, using energy devices on the outside, like the machine that you get in centers and all that can help you actually with this problem as well. But it is best if you come and discuss it with someone like a bariatric surgeon, and that would be the best platform to give you some advice on this. Can I still continue to eat like before prior to my weight loss surgery? No, you should not. Definitely. If you were eating before, if you were eating maybe three chapatis for dinner, then with the weight loss surgery, we will help you to restrict that to maybe one chapati or half a chapati, and you will be full. But you should not have the mindset that you want to go back to eating like before. It should be a renewed mindset. If you have been eating healthily and yet you are still gaining weight, then there's no problem. When we discuss it with you, then it'll be nice for us to discuss this and find out what your eating habits are like. And then subsequently, we decide that, hey, you've been eating well, so you can just continue your old diet. But if you have not been eating well, then and if you have been having a lot of fast food or unhealthy cooking methods, then we are here to help you with that. What lifestyle changes are necessary after weight loss surgery? So the main lifestyle changes that are necessary is your motivation to actually lose weight on yourself, because we give you a jump start. We help you in the beginning, but actually a lot of the work has to be done by you on your own subsequently. So we will help you to reduce a big amount of weight in one go. But to maintain that loss, you have to alter some lifestyle. For example, you have to alter eating habits. You have to alter your routine, for example, for exercises. Number three, you have to avoid stress. You have to get better sleep. You have to drink more water. So these are all small changes that actually go a long way after your weight loss surgery. Do I need to see a psychiatrist before and after the surgery? This is a good question. The answer is yes and no, because we will establish actually why you are seeking our advice for weight loss. If there is an incident that recently occurred that has triggered this, then it is best that we manage it. For example, a recent loss of job, or for example, a recent departure of someone in the family close to you. So these emotional stimuluses actually may have prompted someone to lose weight, but we don't want this stimulus to actually be the primary reason why you want to lose weight. It must be your own intention as well, and we help you to actually enhance that intention. So if we find that you have these type of predispositions, we may refer you to our colleagues. It is not that you have got sakit jiwa, or it is not that we are saying that ini tak betul and all that. No, it is actually just to confirm and just to come to a decision, and also enforce that this decision and this action that you are taking is actually self-driven from yourself, because that is where the best outcome is received, is achieved. That means when it comes from within, we find that the patients have got the best outcome, they lose the most weight, and also they are the happiest when they actually lose that weight. Okay, so is there any other questions that I can address? None? Okay, so if that is the case, let's end this session. We never settle for being the best, we always strive to be better. I would like to take this opportunity to please caution everybody. COVID is still out there. We are not safe. We haven't won the war yet. We have won small battles. Please stick to strict SOPs. Wear your masks in public, hand washing, hand sanitizing. Please be careful when you meet people. Maintain social distancing. Protect our elderly and our children. Please make sure that all these measures are taken. And I wish all of you to be safe. And for any advice or any consultation, feel free to ask us at any time on our media platform, and we will answer you the best I can. Thank you very much.